Our top story now, the COVID vaccine will be ready for rollout in 10 days from the emergency use authorization date based on feedback from the dry run is what the government has said. As for schools reopening, the government said that teachers and adults at home need to be vaccinated first. Sukirti Dwivedi gets us all the details.
India could see its first vaccinations by 13th January.
10 दिन के भीतर हमारी तैयारी रोल आउट करने की है अंतिम निर्णय सरकार द्वारा लिया जाना है
But schools might not open yet as the government wants to vaccinate all the adults first, teachers and parents included.
The United Kingdom has burnt its fingers twice with opening up schools. The more important point here is to remember that the teachers should be the first to be vaccinated. The adults in their families needs to be vaccinated so that the spread is not there.
The government today also continued to defend why the indigenous Bharat Biotech's Covaxin was approved and announced that consent of users will be taken.
Restricted use in clinical trial mode means that they have to give a consent and there has to be a regular follow-up of these participants.
While safety is not an issue with the vaccine, the minutes of the subject expert committee's meeting on 2nd January show that Bharat Biotech did not give any efficacy data for human participants. The only efficacy data that was given was of non-human participants like rats and hamsters. And experts agree on the need for more data.
Unfortunately, we are talking this as a controversy. So, which clearly means that there should be more communication, there should be more information. More data is better because that gives you more confidence.
After taking pot shots at each other for the last 2 days, the vaccine makers, Serum Institute of India and Bharat Biotech, today issued a joint statement saying that they jointly communicate pledge towards a smooth rollout of COVID-19 vaccines and pledge to provide global access for COVID-19 vaccines. The government today declared that no vaccine firms have been banned from exporting their product.
While the government has said that exports are allowed, the first doses from both firms are expected to be used in India only. Serum Institute of India has 50 million doses ready, while Bharat Biotech has 10 million doses. With Uma Sudhir in Hyderabad and camera person Gauri Prasad, in New Delhi, this is Sukirti Dwivedi for NDTV.
Aadhaar authentication and SMS confirming vaccination in at least 12 languages are some of the features of the CoWIN app that India has developed to inoculate millions of people against coronavirus. Here's an explainer.
All right, the vaccine rollout is all set to happen in India in less than 10 days from now, and it will be the largest inoculation drive in the world, bigger than the general elections if the government is to be believed. The one stop for vaccination process will be the CoWIN app. CoWIN, which starts and stands for COVID Vaccine Intelligence Network and has launched solely for the upcoming COVID-19 vaccination drive to track and monitor beneficiaries across the country. Now, if you want to be vaccinated against COVID, you need to register on the app. There is no other way. And all this will happen on the app, which hasn't even been launched yet, but NDTV has a sneak peek for you. Let's bring out what the home page of this app is going to look like. That's what it will be like, and it will be available for download on all your app stores and Apple and Android phones as well. There will be a website version as well. Now, data for 75 lakh frontline workers has been auto-uploaded on this app. For non-frontline workers, that's ordinary folks like you and I, there will be a need to register. Once you go on the home page of the app, there will be 3 registration options. There is an option to self-registrate, individual registration and bulk registrations. But all you have to do is go in and select self and then upload your photo identification. That means your Aadhaar, driving license, PAN card, anything will really work here. And after completing your registration, your details through the CoWIN app will reach your district authorities, meaning your DMs. The district authorities will then approve beneficiaries or the recipients of these vaccines. Once approved, a date, time and location will be allocated for your vaccination, and you will get it via an SMS on your phone. Once vaccinated, you will also receive a QR code based a vaccination certificate as well, which will be followed up. It's a massive exercise, and then if you have any follow-up questions, etc., there will be a chat option as well with which you can communicate directly with the government.
Well, let's go across to Sukirti for more. And Sukirti, so exciting now. In just a week, 10 days, the vaccination process is going to begin in India. We're still waiting for that final word from the government. But everyone wondering just how to, go about it. And what we do know is that healthcare workers and the elderly are first in line. The general population probably will get it in several months to come.
Yes, Gaji. This is the kind of announcement everybody has been waiting for, a proper timeline. And it is a start in the way that the Health Secretary did say that 10 days from the date of the emergency use authorization, we are ready to introduce the rollout. So the emergency use authorization was on 3rd January. So it is being expected that somewhere around 13 January, we should see the rollout of the vaccine. But like you pointed out, for the general public, the vaccine will still not be available. It will be first 1 crore healthcare workers, then 2 crore frontline workers, and then the 27 crore people who are either above the age of 50 or below 50 and have comorbidities. And yesterday the government also clarified on the 3rd priority group, saying that there is an expert committee that is still working out on the criteria for comorbidities. For example, a lot of people have hypertension, but not everybody with hypertension will be considered priority at this moment. There is an expert committee that is looking at the severity of each comorbidity that would qualify one to get vaccinated. So what is the degree of hypertension that one should have? What is the degree of diabetes that one should have in order to qualify for vaccination? So all of those modalities are still being worked out.
All right, Sukirti, thanks so much for joining us with those details. So as India prepares to start the vaccinations against the COVID pandemic, remember it's going to be the biggest exercise anywhere in the world. Its most populous state, Uttar Pradesh, on Tuesday held a vaccination dry run across 75 districts. 3 days after holding it at 6 locations in the capital Lucknow, the dry run was held at 3 urban and 3 rural areas of each district. Take a look.
A massive COVID vaccination dry run in all 75 districts of India's most populous state, a population 3 times more than the United Kingdom. This was Uttar Pradesh's second dry run in less than a week as the state government gears up for a big logistical challenge, vaccinating over 20 crore people in the shortest possible time. In West UP's Aligarh, this government rural hospital will serve as the vaccination hub for people from 200 plus village panchayats.
ये जरूर समझना चाहिए कि ये एक डमी एक्सरसाइज थी, इसमें कोई ओरिजिनल वैक्सीन नहीं लगाई गई, इसे केवल एक प्रयोग की तरह से एक डेमो दिया गया और उसके बाद उन्हें ऑब्जर्वेशन रूम में ले जाया गया.
Today the state's health minister indicated there may be a delay in the start of the vaccination drive. 3 days ago, UP Chief Minister Adityanath had said it would start near Makar Sankranti, which is on the 14th of January.
विश्वास के साथ कह सकते हैं कि मकर संक्रांति के आसपास हम लोग वैक्सीन लेकर के प्रदेश की जनता के लिए वैक्सीन लेकर के भी हम प्रदेश के अंदर और देश के अंदर इस कार्यक्रम को आगे बढ़ा करके इस सदी की सबसे बड़ी महामारी को परास्त करने में सफल होंगे.
हमारे राज्य में जब आएगा फिर हम अपने मेन हेडक्वार्टर से लेके जिला अस्पतालों से लेके सामुदायिक स्वास्थ्य केंद्र तक पहुंचाएंगे. फिर ये प्रारंभ हो जाए तो ये पूरा जो लॉजिस्टिक्स है सप्लाई का ये लगभग 10-15 दिन तो लग ही जाए.
The dry runs are happening at a time when there is growing concern over a mutated strain of the coronavirus that seems to be spreading rapidly. Meerut in Western UP has thrown up 5 cases so far. With Adnan Khan, Sarfaraz and Salim Khan, this is Alok Pandey, NDTV.
Meanwhile, speaking of the Republic Day celebrations, it will be low-key this year given the COVID pandemic. There will only be 25,000 who will be seated along the Rajpath instead of the usual 1.15 lakh. Each army contingent will have 96 soldiers instead of 144, a tableau of 22 to 25 and 160 school children instead of the 600 last year. No child under 15 years of age, and all soldiers to be in a bio bubble ahead of the Republic Day, and strict COVID precautions will be taken for all the participants. In other news now, states such as Rajasthan, Himachal Pradesh, Madhya Pradesh and Kerala are all battling both COVID and a bird flu scare. Bird flu, also called avian influenza, is a viral disease that can spread from one bird to other birds and animals. After tests of samples of dead birds in Rajasthan, where many dead crows were found, bird flu was confirmed in some of the carcasses. Some other states have also sounded an alert to tackle the spread. Samples of dead migratory water birds were found along the Pong Dam Lake in Himachal Pradesh, also tested positive for the avian influenza. Over 2,700 birds have died. The national parks and wildlife sanctuaries have also been asked to take all precautions, and there's an alert as poultry is also being watched very closely. In Haryana, 4 lakh poultry birds have died in 10 days, and Haryana has issued an advisory as well, an alert in Madhya Pradesh as well after the death of 376 crows was reported. And as we said, in Rajasthan and Himachal Pradesh, alerts as well. In Kerala, some 12,000 ducks were found dead. 36,000 will now be culled. And today on our show, FYI, we will be looking more deeply into the bird flu scare. News now from Uttar Pradesh, and a Muslim shopkeeper in western UP's Bulandshahr is in custody of the police after an FIR against him for selling a shoe on whose sole it had the brand name Thakur. Now, the man Nasir was detained by the police after complaint by Vishal Chauhan, a leader of a right-wing outfit in the area, who claims he interpreted it as a reference to the Thakur caste. Nasir has been booked under serious sections of the law like promoting enmity between different groups on grounds of religion, causing hurt and intentionally insulting someone, resulting in breach of public peace. And in this video that you can see on your screens that went viral, it shows a group of men surrounding the shopkeeper, who argues back that he's not the one who's making the shoes, he's simply selling them. However, he has now been booked.
हम लोगों का नाम है ठाकुर फुटवेयर कंपनी, फर्म का नाम है, कंपनी का नाम है। हम कभी भी किसी भी फुटवेयर में ठाकुर नाम नहीं लगाते हैं। हम लोग मशहूर हैं ठाकुर के नाम से, लेकिन आज के दौर हम लोग उसमें लिखते हैं, शॉर्ट फॉर्म में लिखते हैं TFC। उसकी फुल फॉर्म है ठाकुर फुटवेयर कंपनी। क्योंकि हमारे जितने भी कस्टमर हैं सब ठाकुर हैं और हमसे बहुत प्यार करते हैं और हम उनसे बहुत प्यार करते हैं। हम कोई भी ऐसे काम नहीं करना चाहते कि कहीं भी किसी को कोई आहत पहुंचे। ये किसी ने बदनाम करने की कोशिश की गई है और कुछ नहीं है।
And news from Karnataka, where the ordinance to stop the killing of cattle came into effect after the governor cleared it yesterday. The ordinance clears the way to punish people for killing cattle and protects those acting in good faith to save them. A bill on this is yet to be cleared by the Legislative Council. Those found guilty of cattle slaughter can be jailed from up to 3 to 7 years with a fine between 50,000 to 5 lakh. And a person found guilty of cattle slaughter for a second time will be jailed for 7 years and fined from 1 to 10 lakh.
Karnataka has a new ordinance in place with the Karnataka Prevention of Slaughter and Preservation of Cattle Ordinance 2020 being promulgated by the governor on Tuesday. The note says, the order from the governor says, that the Karnataka Legislative Assembly and the Karnataka Legislative Council are not in session, and the governor of Karnataka is satisfied that the circumstances exist which render it necessary for him to take immediate action to promulgate the ordinance. Now, the ruling BJP in Karnataka had tried to get this new law passed through the legislature, and the bill had in fact been passed by the assembly, but the BJP knew it could not get the act passed in the council, where it is outnumbered by the opposition Congress and the JDS. Both those parties had made it very clear that they viewed the bill as anti-farmer and that they would not support it in the council, which is when the BJP decided it would take the ordinance route. It didn't indeed do that, and the ordinance has now been promulgated by the governor. Now, the new rules make it much tougher. Punishments are much tougher for those who actually violate those rules. The jail term can go up to 7 years. The fine is 5 lakhs, which can go up to 10 lakhs for a second offence. and by promulgating this ordinance, it actually repeals the Karnataka Prevention of Cow Slaughter and Cattle Preservation Act of 1964. So with the promulgation of this new ordinance, those new rules are in place, tougher laws, tougher punishments in place for the protection and preservation of cattle here in the state of Karnataka. Maya Sharma in Bengaluru for NDTV.
And news now from West Bengal, where there's been another major setback for Mamata Banerjee ahead of elections in the state. A key minister, Lakshmi Ratan Shukla, has quit, though the chief minister says that there's no misunderstanding.
Politics is just not cricket. That's what this batsman turned Trinamool MLA discovered in 5 years as Minister of State for Sports in Bengal, and wrote to Chief Minister Mamata Banerjee today saying he wants out.
লক্ষ্মী ভালো ছেলে, লক্ষ্মী পদত্যাগ করেছে, ঠিক আছে, ও বুঝেছে, ও ক্রিকেটে ও লিখেছে যেটা চিঠিতে, ও মিনিস্ট্রি থেকে পদত্যাগের কথাটা লেখেনি। চিঠিতে যেটা লিখেছে যে আমি সমস্ত রকম রাজনীতি থেকে সরে যেতে চাই খেলার প্রয়োজনে, এবং সেই জন্য আমি রাজ্যপালকে রেকমেন্ড করছি যে ওর ইস্তফাটা নিয়ে নেওয়া হোক, এবং আমি নিশ্চয়ই চাই ও ভালো করে খেলাধুলা করুক।
A stiff upper lip, that's what BJP is calling the Chief Minister's reaction. It has already wooed away a senior Trinamool minister, Shubhendu Adhikari, and BJP chief Dilip Ghosh said today the Trinamool was losing a wicket a day, though there is no signal yet that Shukla is switching sides.
সেজন্য যাদেরকে জোর করে বা অন্যভাবে আটকে রেখেছিলেন তারা মুক্তি চাইছেন। আমার মনে হয় লক্ষ্মী রতন শুক্লার পদত্যাগ করাটা সেটা একটাও কারণ হতে পারে।
The 39-year-old cricketer who joined politics in 2016 and won on a Trinamool ticket from the Howrah North seat has been incommunicado after news of his resignation broke. Trinamool MLA from the adjoining seat, Vaishali Dalmia, blamed termites in the party for Shukla's loss. Shukla's exit should make Trinamool sit up. Another minister, Rajiv Banerjee, has been conspicuous lately for his comments critical of the party. And not for the first time, Mr. Banerjee was absent from the cabinet meeting today as well. With G.D. Shankar, Monideepa Banerjee, NDTV.
Welcome back. Now, the Bharatiya Kisan Union is imparting driving training to women hailing from villages, who will then lead a procession of tractor trolleys carrying farmers to participate in the tractor parade that's being planned in Delhi on Republic Day. Take a look.
Women in the driving seat, the plan for the tractor parade to New Delhi on Republic Day. Women from Haryana villages are polishing up their tractor driving skills to join the protest if farmers' demands are not met by 26th of Jan. This was one such tutorial at the Khatkar Toll Plaza on the Jind-Patiala National Highway.
हम ट्रेनिंग लेने लग रहे हैं, जो सरकार नहीं मानेगी ना तो 26 तारीख ना हम परेड कराएंगे दिल्ली।
शक्ति जो हमारी ये किसानों की बहू बेटी है और ये सब कुछ चलाना जानती है, हथियार भी चलाना जानती है, ट्रैक्टर भी चलाना जानती है, मोटरसाइकिल भी चलाना जानती है। अगर 4 तारीख को नहीं मानी, 6 तारीख को पूरा दिल्ली, क्या राजपथ, क्या पलवल बॉर्डर, पूरा दिल्ली में हमारी महिला ट्रैक्टर चलाएंगी।
सरकार के लिए आज टेलर है, खटखट क्लोजअप है। यदि सरकार मानती है तो ठीक है, नहीं मानती ना, यहाँ तो 10-12 ट्रैक्टर हैं, ट्रेनिंग ले चुके हैं, लाखों की संख्या में लेडीज हैं, अपने ट्रैक्टरों के साथ वहाँ पहुँचेंगी और परेड करेंगी लाल किले पे। ये इतिहास होगा।
By having women ride into the national capital on their tractors on Republic Day will be a startling change for a patriarchal Haryana. And the farm unions, they also just don't want to grab eyeballs, but want to send out a message that their families also stand behind them in this agitation. With Dilbag Ahlawat in Jind, in Chandigarh, Mohammad Ghazali for NDTV.
The construction of the new Parliament complex near Delhi's India Gate can go ahead, as the Supreme Court said on Tuesday in response to petitions that challenged the Central Vista project in terms of permissions and clearances. It was a 2-1 verdict. Vedanath reports.
The NDA government's mega project, the Central Vista, has been allowed by the Supreme Court. The 20,000 crore project, reconstructing the heart of Delhi, was opposed by environmental experts and political parties. Of the 3 judges, 2 approved the clearances for the project and 1 dissented. The 2 judges ruled, all permissions are proper. Government can go ahead with the project. No infirmities in clearances given on land use and environment. No need for approval at the incipient stage, but approval should be sought when project materializes on the ground. And to control air pollution, set up smog towers and use smog guns at the construction site. On the criticism of spending huge money, 2 judges said, "We are compelled to wonder if we, in the absence of a legal mandate, can dictate the government to desist from spending money on one project and instead use it for something else. Or if we can ask the government to run their offices only from areas decided by this court. Or if we can question the wisdom of the government in focusing on a particular direction of development. Or if we can guide the government on moral or ethical matters without any legal basis." The other judge differed with the 2 judges, saying, "Change in land use is bad in law. There is no intelligible disclosure of public participation. These are complex issues and Heritage Conservation Panel must examine all aspects." Around 587 days left to complete the new Parliament by Independence Day, August 2022, India's 75th year of independence. The Lok Sabha Speaker welcomed the verdict. Construction work will be completed on time. But opposition parties and environmentalists criticized the verdict.
A trend has emerged as far as judiciary is concerned. That is, the judiciary goes on approving the positions taken by the union government.
Though Justice Sanjeev Khanna gave a dissenting verdict, it will have no impact because the majority judgment will prevail. And this verdict is a big relief for the government, which is facing severe criticism over the Central Vista project in the national capital. In New Delhi, Arunachalam Vaidyanathan, NDTV.
First, the Tamil Nadu government has said that movie halls in the state will be permitted to screen movies at full seating capacity, that's 100%. But this decision to allow full occupancy in theatres has not gone down well among healthcare professionals and public health experts. In fact, a Facebook post of a doctor also went viral. It was an open letter which he addressed to actors Vijay and Silambarasan, who had met the Chief Minister with the request to open up theatres for the public, and he's also addressed it to the Tamil Nadu government. He says, from a poor, tired resident doctor. He said thousands of doctors like him, healthcare workers, police officials and sanitary workers are just tired. Well, let's go across to Sam Daniel for more on this entire story. And Sam, this comes just after these clusters of COVID infections were found in hotels. And now this decision to allow, 100% occupancy in theatres has everyone quite divided.
That's right. People are quite divided, Gargi, but certainly many health professionals have taken to social media warning public the risk involved in going to theatres which would have 100% seating occupancy, particularly poorly ventilated, closed situations like this where there will be no physical distancing when 100% occupancy is allowed, could actually lead to explosion of cases amid a declining trend in Tamil Nadu. That's what many have warned. And Dr. Prabdeep Kaur, a public health expert, in her tweet has said that closed spaces without social distancing are perfect setting for explosive spread of COVID-19 and requests public to avoid such settings. And this, as you said, comes amid the reporting of 2 star hotel clusters with 125 new cases in Chennai recently. And little earlier we had IIT Madras, which also reopened for certain sections of research scholars, reported more than 100 positive cases, which was also termed as a cluster by the Tamil Nadu government. And the health secretary has said the government has put in place an SOP, and he would get back on concerns expressed by various quarters. On the other hand, theatre owners say for the last several months, close to a year, they've been suffering huge losses because of lockdown earlier. And now, although 50% is allowed there, they say it's not commercially viable. And particularly over the last few months since Diwali, when these theatres were allowed, they say they've never had a big release to be able to make up for the losses. And they say they employ around 40,000 people across Tamil Nadu in the 1,000+ theatres. And only if the government allows them to open up, they say they'll be able to salvage, they'll be able to redeem themselves. And that's their concern. And they say, besides following the established protocol in terms of hand sanitizers, not allowing the elderly to ensure physical distancing in other places except inside the hall, they would also make sure they would only provide packed food and not open food, which could again pave way for explosion of cases. Politically speaking, elections are just 6 months away in Tamil Nadu, and many are also giving a political motive to the meeting by actor Vijay, who has a huge following, and the Tamil Nadu government's decision to yield to that request, saying that perhaps the ruling AIADMK is trying to gain mileage by the popularity of actor Vijay, who also has political aspirations, and by paving way for his film to have a huge release. Perhaps the government wants him to endorse for elections in terms of supporting the ruling AIADMK. Of course, off record, ruling AIADMK sources have denied these allegations as speculative, and they say we are now in an era of learning to live with corona, with all the SOPs in place, just like schools and colleges are being slowly opened up, just like institutions have been allowed, just like trains and bus services are also slowly turning to normalcy. They look at this as one part of restoration of normalcy, which many health experts and doctors individually, who also are on the front line fighting it over the last close to 1 year, they say cannot be allowed in this kind of a fashion, particularly amid the risk of the new variant and also amid the risk of reports of clusters in Chennai. Gargi.
Right, Sam, thanks so much for joining us with that, and especially, given that now the vaccine does seem to be around the corner. Well, to talk more about this, we're joined by Dr. Sumant Raman, a political commentator, Professor Dr. Anita Ramesh, and Nikhilesh Surya, Rohini Theatre owner. And first to you, Sumant Raman, if you what is your reaction to this? It's a tricky one in terms of, lives and livelihood, but movie theatres, I can absolutely understand that poor doctor who's written an open letter saying we're all very, very tired, and everybody at the front line is tired and we don't want another spike in cases.
Yeah. Gargi, see, there are three very important issues here. One is this guideline of 100% occupancy violates the Ministry of Home Affairs the relaxation guidelines which are issued. The last guideline, I think, which was issued was sometime towards end of November, which has then been extended. So, which mandates that theatres can function with 50% occupancy. So, this 100% occupancy guideline of the Tamil Nadu government is a clear violation of that. In fact, the MHA also said that states could be stricter than these guidelines, but not more lenient than those guidelines. So, that's point number one. Point number two is that Tamil Nadu government consistently used to hold meetings with their own medical committee before announcing relaxations. Now, this was followed until, if I remember right, until sometime in mid-November, where the Chief Minister himself used to meet the medical committee, which included experts from ICMR and, other agencies of the state as well. And after that, decisions would be announced. Now, clearly, the medical committee does not seem to have been consulted, because Dr. Pradeep Kaur, who's part of the medical committee, has clearly put out a tweet saying that, this is not safe, and literally saying, people, please don't go, So that is the second point. The third point is, I think that the entire argument of the theatre owners and, the cine fans and so on is that rules are being violated everywhere. So why not violate rules in the theatres as well? Trains are going, air-conditioned coaches and trains are being permitted with full occupancy. Buses are allowed to function with full occupancy. So what is the problem with the theatres also functioning with full occupancy? Now, medically, that is a huge risk. And to say that, others are doing mistakes, so therefore, why should theatre owners alone be penalized?
All right, well, let's get a theatre owner in here. Nikhilesh Surya, your response to this and your, response to this decision, you, of course, must be happy, but, it's become quite a controversy in the state.
Yeah, no, it has been a long pending demand for us for the past couple of months, because the industry has still not seen a revival. I mean, there's really no point functioning at 50% occupancy, as it has been a chicken and egg problem. None of the movie producers are ready to release their movies, and we just, I mean, we've been open, but we've not been able to do anything, quite literally. With zero revenue, we're not able to function. And see, when the entire economy is claimed to be back on track, when GST collection is at an all-time high, when everything is functioning normally, even we have our financial commitments, nobody's going to give us any moratoriums or extensions or any leeway with that aspect. Or, you know, at least the government should have given us something else. So when nothing's in place and when everything else is functioning normally, like Sir said, then I really don't see a point in holding us back alone. All the festival season and all the metros and all the cities and towns of India, we saw shopping districts being crowded, and we really didn't see any great spike in cases. I mean, I'm not 100% right, but from whatever I read and saw, there was any great spike in cases during the festival season. So I think with adequate, in a theater, it's more a controlled environment than, you know, huge shopping centers and shopping districts where you really can't regulate the crowd. Here, you buy a ticket, you stand in line in a queue, and then you enter the cinema hall. You can be sanitized, you can be temperature checked. So many things that can be done here, which cannot be done in a lot of other places, like in buses, trains, and malls and beaches. So yeah, this whole aspect of you know, being in a closed environment, that really doesn't matter if it is 50% occupancy or 100% occupancy. Even if in the same closed environment, if 300 people are going to be there or 500 people are going to be there, it's the same. And so far, there has been no reported case traced back to cinema halls, so no clusters traced back to cinema halls in the entire world.
Well, not yet,
India.
and we don't want to, you know, challenge that. Dr. Anita, your response to this decision, are you disappointed, and widen your message to people?
Yes, I actually don't agree with that decision, because, and I'm with the public and I'm also with the healthcare professionals. We are doing very well. If you see Tamil Nadu figures, the positivity rate is just 1.53%, less than 5% the expected. And all over India, and Tamil Nadu is doing really well in COVID control. We healthcare workers are working day and night for last 7-8 months. I don't remember I've taken a day off from the work, but then we are able to control it. So we should not lose our gears. And 2 recent evidence of IIT Madras and 2 luxury hotels reporting cluster of cases frightens all of us. And the new strain out of the country is also very virulent, and people coming back to India is carrying it. The number of cases abroad is increasing. Lockdown is reinforced. So again, India might face a second wave, and we are all worried about it. So as on today, coming back to the theatres, 100% occupancy, I do not agree, because it's a closed space and it is for 2 hours somebody is going to sit. They definitely open the marks, they're going to eat, they're going to talk, push to each other and start talking, and that will be a super spreader of the virus. So, and also this all puts us into a fear that opening a theatre and 2 hours people sitting close to each other without social distancing, whatever you say, you put sanitizer, you put thermal check, you put your mask on, but you're going to sit there in the closed AC hall for next 2 hours itself is frightening. So I would not suggest that, yes, but what I will suggest, I will not suggest that 100% occupancy should be there, but as a healthcare professional, don't increase the load on us. What you can do is that, I understand India needs to bounce back. This is a particular industry, even my husband is also involved in this industry, but what I suggest is that you have the show timings increased. Maintain 50%, maintain the SOP, continue, but have more shows so that you can accommodate more people. And that people will also have confidence. Yes, I will go to a movie, I'm safe. And again, still the vaccine is completely, we are all vaccinated another 4-5 months. We should not dare to do anything which will help us to slip down.
Right. Dr. Sumant, Raman, it does seem that, you know, the reasons for opening up are not because of, as you were pointing out, that, you know, the medical committee met and advised this. It was after actor Vijay went and met the chief minister, another actor also met them, that this decision was taken. So, you know, and because of the Pongal festivities, etc. So it does seem that there were overriding reasons, and political as well, as Sam was pointing out earlier.
Yeah. Look, Gargi, across India, there is now a feeling that India is sort of immune from a second wave. Now, I don't know how different state governments and the public at large seem to have come to this conclusion, but it flies in the face of logic. Because if you look at the Western countries, particularly Europe and the US and so on, they had a huge dip in cases in July, August, and until mid or end September. And then the second wave started taking off really from October. So that we are actually 3 months behind Europe and America. So I don't know on what basis by we I mean the central government, state governments, public, everyone believes that the COVID problem is more or less sort of taken care of, and we will not have a second wave. Because if we look at the Western countries, and if we are assuming we are 3 months behind, then December, January is the time for a second wave to actually happen in India. There are lots of things about COVID that we do not know. Agreed. Shopping malls were packed during the Diwali shopping season. Nothing happened. No major spikes were there. But when there is hopefully an end in sight with a vaccine, may not be in 3 months, at least in 6 to 9 months, why are we actually going out and taking a huge risk? Because we do not have the infrastructure and the facilities to control a mass outbreak of a potentially mutant strain that could spread 70% faster. Remember, our hospitals and ICUs were actually pretty stretched even during the peak of the first wave. So we don't want to do something that can actually trigger a second wave.
Right, Nikhilesh, Surya, so, you know, a lot of responsibility on theatre owners, given that 100% occupancy is going to be allowed, as you said, that you wanted some sort of relief from the government, and now you're looking forward to having your theatres open. But many are also pointing out it is also the responsibility of the public whether they do indeed go back to the theatres.
Yes, of course. I think with more than relief, we are actually burdened with a lot of responsibility, and I think we are happily taking it up. And we are there is a lot of self-regulation in place among theatres. Actually, when you see the 50% occupancy and the SOPs in place, it actually made no sense, because people were asked to sit one seat in between each other. But when you're coming as a couple or as a family, there is no point in sitting separately. I mean, you're coming from the same house in the same car.
Well, I'm sure the doctors
what we are planning to do now is to make people sit in groups together and leave seats in between them, in between groups, which would make more sense. And I think it works out around 70 or 75% occupancy overall, which would be the average number. So we're looking at self-regulations like that, and we're also looking for the people to take it upon themselves to have their masks worn all the time. We will be doing our best to ensure that they'll be doing that. So
right.
It really, it can't be just pinpointed to one person. I think everybody is a stakeholder, and everybody needs to look out for themselves and for others.
All right, well, thanks for that. But clearly the doctors disagree. I'm sorry, I'm completely out of time, but clearly the doctors have many concerns regarding this decision, and it does seem that it's not, public safety that was the overriding reason to take this decision. Dr. Neeta, one last word from you.
Yes, also, if we are at all planning to open, say, like our colleague has said, 70%, but then please avoid the vulnerable society, elderly, those with comorbidity. And these people should be avoided, because if they get infected, they straight go to ICU. Mortality is very high, so they should be avoided. But overall, please wait till the vaccine has been given, then we can open in 100%. I understand India needs to bounce back, but we need to balance and carry on.
And it does seem the vaccine is around the corner. From perhaps next week, the vaccination drive will begin.
Next week, all of us will get the vaccine.
Thank you all for joining us on the show today for discussing this issue of the cinema halls reopening in Tamil Nadu at 100% capacity. All right, so Boris Johnson won't be coming for Republic Day celebrations, and let's talk more about those celebrations. It will be a low-key affair this time around. Given the pandemic, there will only be 25,000 who will be seated along the Rajpath instead of the usual 1.15 lakh. Each army contingent will have 96 soldiers instead of 144. The tableau is up from 2225 to 32. 160 school children instead of the 600 school children who participated last year. No child under the age of 15 will participate, and all soldiers to be in a bio bubble ahead of the Republic Day. Strict COVID precautions also for all the participants. Now, who's also readying for Republic Day are the farmers. The Bharatiya Kisan Union is imparting driving training to women hailing from villages, who will then lead a procession of tractor trolleys carrying farmers to participate in the tractor parade in Delhi on Republic Day.
Women in the driving seat, the plan for the tractor parade to New Delhi on Republic Day. Women from Haryana villages are polishing up their tractor driving skills to join the protest if farmers' demands are not met by 26th of Jan. This was one such tutorial at the Khatkar Toll Plaza on the Jind-Patiala National Highway.
हम ट्रेनिंग लेने लग रहे हैं, जो सरकार नहीं मानेगी ना, तो 26 तारीख ना हम परेड कराएंगे दिल्ली।
शक्ति जो हमारी ये किसानों की बहू बेटी हैं और ये सब कुछ चलाना जानती है, हथियार भी चलाना जानती है, ट्रैक्टर भी चलाना जानती है, मोटरसाइकिल भी चलाना जानती है। अगर 4 तारीख को नहीं मानी, 6 तारीख को पूरा दिल्ली, क्या राजपथ, क्या पलवल बॉर्डर, पूरा दिल्ली में हमारी महिला ट्रैक्टर चलाएंगी।
सरकार के लिए आज टेलर है, खटखट क्लोजअप है। यदि सरकार मानती है तो ठीक है, नहीं मानती ना, यहाँ तो 10-12 ट्रैक्टर हैं, ट्रेनिंग ले चुके हैं, वहाँ लाखों की संख्या में लेडीज हैं, अपने ट्रैक्टरों के साथ वहाँ पहुँचेंगी और परेड करेंगी लाल किले पे। ये इतिहास होगा।
By having women ride into the national capital on their tractors on Republic Day will be a startling change for a patriarchal Haryana. And the farm unions, they also just don't want to grab eyeballs, but want to send out a message that their families also stand behind them in this agitation. With Dilbaga Hilawat in Jind, in Chandigarh, Mohammad Ghazali for NDTV.
News now from Tamil Nadu, where the government has said that movie halls in the state will be permitted to screen movies at full seating capacity. But this decision to allow full occupancy in theatres has not gone down well among healthcare professionals and public health experts. In fact, a Facebook post of a young doctor also went viral. It was an open letter which was addressed to actors Vijay and Silambarasan, who had met the Chief Minister with the request to open up theatres for the public and the Tamil Nadu government from a poor, tired resident doctor. He said thousands of doctors like him, healthcare workers and police officials and sanitary workers were tired. Earlier we spoke to Sam Daniel for more details.
Certainly many health professionals have taken to social media warning public the risk involved in going to theatres which would have 100% seating occupancy, particularly poorly ventilated, closed situations like this where there will be no physical distancing when 100% occupancy is allowed could actually lead to explosion of cases amid a declining trend in Tamil Nadu. That's what many have warned. And Dr. Prabdeep Kaur, a public health expert, in her tweet has said that closed spaces without social distancing are perfect setting for explosive spread of COVID-19 and request public to avoid such settings. And this, as you said, comes amid the reporting of 2 star hotel clusters with 125 new cases in Chennai recently. And little earlier we had IIT Madras, which also reopened for certain sections of research scholars, reported more than 100 positive cases, which was also termed as a cluster by the Tamil Nadu government. And the health secretary has said the government has put in place an SOP and he would get back on concerns expressed by various quarters. On the other hand, theatre owners say for the last several months, close to a year, they've been suffering huge losses because of lockdown earlier. And now, although 50% is allowed there, they say it's not commercially viable. And particularly over the last few months since Diwali, when these theatres were allowed, they say they've never had a big release to be able to make up for the losses. And they say they employ around 40,000 people across Tamil Nadu in the 1,000+ theatres. And only if the government allows them to open up, they say they'll be able to salvage, they'll be able to redeem themselves. And that's their concern. And they say, besides following the established protocol in terms of hand sanitizers, not allowing the elderly to ensure physical distancing in other places except inside the hall, they would also make sure they would only provide packed food and not open food, which would again pave way for explosion of cases. Politically speaking, elections are just 6 months away in Tamil Nadu, and many are also giving a political motive to the meeting by actor Vijay, who has a huge following, and the Tamil Nadu government's decision to yield to that request, saying that perhaps the ruling AIADMK is trying to gain mileage by the popularity of actor Vijay, who also has political aspirations, and by paving way for his film to have a huge release. Perhaps the government wants him to endorse for elections in terms of supporting the ruling AIADMK. Of course, off record, ruling AIADMK sources have denied these allegations as speculative, and they say we are now in an era of learning to live with corona, with all the SOPs in place, just like schools and colleges are being slowly opened up, just like institutions have been allowed, just like trains and bus services are also slowly turning to normalcy. They look at this as one part of restoration of normalcy, which many health experts and doctors individually who also are on the front line fighting it over the last close to 1 year, they say cannot be allowed in this kind of a fashion, particularly amid the risk of the new variant and also amid the risk of reports of clusters in Chennai.
Now, the Supreme Court will take up petitions against love jihad laws that were passed by Uttar Pradesh and Uttarakhand. The petition by lawyers and NGO Citizens for Justice and Peace have challenged the constitutional validity of these laws enacted by UP and Uttarakhand. The petition by lawyers said that these laws disturb the basic structure of the constitution, and the plea by the CJP said that the law is an illusory construct based on rhetoric to promote divisiveness in society, generate permanent suspicious attitudes towards Islam and the Muslim community, and create enmity between communities and breach harmony. The petition has raised issues over privacy, excessive constitutional powers to the police, and alleges the law must be struck down because it violates secularism, equality and non-discrimination. So those pleas will be taken up by the Supreme Court. Now, in Karnataka, the ordinance to stop the killing of cattle came into effect after the governor cleared it yesterday. The ordinance clears the way to punish people for killing cattle and protects those acting in good faith to save them. A bill on this is yet to be cleared by the Legislative Council. Those found guilty of cattle slaughter can be jailed from 3 to 7 years with a fine between 50,000 to 5 lakh.
In place with the Karnataka Prevention of Slaughter and Preservation of Cattle Ordinance 2020 being promulgated by the governor on Tuesday. The note says, the order from the governor says, that the Karnataka Legislative Assembly and the Karnataka Legislative Council are not in session, and the governor of Karnataka is satisfied that the circumstances exist which render it necessary for him to take immediate action to promulgate the ordinance. Now, the ruling BJP in Karnataka had tried to get this new law passed through the legislature, and the bill had in fact been passed by the assembly, but the BJP knew it could not get the act passed in the council, where it is outnumbered by the opposition Congress and the JDS. Both those parties had made it very clear that they viewed the bill as anti-farmer and that they would not support it in the council, which is when the BJP decided it would take the ordinance route. It didn't indeed do that, and the ordinance has now been promulgated by the governor. Now, the new rules make it much tougher. Punishments are much tougher for those who actually violate those rules. The jail term can go up to 7 years. The fine is 5 lakhs, which can go up to 10 lakhs for a second offence. And by promulgating this ordinance, it actually repeals the Karnataka Prevention of Cow Slaughter and Cattle Preservation Act of 1964. So with the promulgation of this new ordinance, those new rules are in place, tougher laws, tougher punishments in place for the protection and preservation of cattle here in the state of Karnataka. Maya Sharma in Bengaluru for NDTV.
News now from West Bengal, and there's been another major setback for Mamata Banerjee ahead of the elections in the state. A key minister, Lakshmi Ratan Shukla, has quit. The chief minister, though, says there's no misunderstanding.
Politics is just not cricket. That's what this batsman turned Trinamool MLA discovered in 5 years as Minister of State for Sports in Bengal, and wrote to Chief Minister Mamata Banerjee today saying he wants out.
লোক কি ভালো ছেলে, ও কি পদত্যাগ করেছে, ঠিক আছে, ও বুঝেছে, ও ক্রিকেটে ও লিখেছে যেটা চিঠিতে, ও মিনিস্ট্রি থেকে পদত্যাগের কথাটা লেখেনি। চিঠিতে যেটা লিখেছে যে আমি সমস্ত রকম রাজনীতি থেকে সরে যেতে চাই খেলার প্রয়োজনে, এবং সেই জন্য আমি রাজ্যপালকে রেকমেন্ড করছি যে ওর ইস্তফাটা নিয়ে নেওয়া হোক, এবং আমি নিশ্চয়ই চাই ও ভালো করে খেলাধুলা করুক।
A stiff upper lip, that's what BJP is calling the Chief Minister's reaction. It has already wooed away a senior Trinamool minister, Shubhendu Adhikari, and BJP chief Dilip Ghosh said today the Trinamool was losing a wicket a day, though there is no signal yet that Shukla is switching sides.
সেজন্য যে যাদেরকে জোর করে বা অন্যভাবে আটকে রেখেছিলেন তারা মুক্তি চাইছেন। আমার মনে হয় লক্ষ্মীরতন শুক্লার পদত্যাগ করাটা সেটা একটাও কারণ হতে পারে।
The 39-year-old cricketer who joined politics in 2016 and won on a Trinamool ticket from the Howrah North seat has been incommunicado after news of his resignation broke. Trinamool MLA from the adjoining seat, Vaishali Dalmia, blamed termites in the party for Shukla's loss. Shukla's exit should make Trinamool sit up. Another minister, Rajiv Banerjee, has been conspicuous lately for his comments critical of the party. And not for the first time, Mr. Banerjee was absent from the cabinet meeting today as well. With G.D. Shankar, Monideepa Banerjee, NDTV.
All right, and staying with news from West Bengal, former Indian skipper and current BCCI President Sourav Ganguly will be discharged from hospital today. That's what the CEO of Woodlands Hospital in Kolkata confirmed, and said that Ganguly will be monitored daily at home. Now, Ganguly had suffered a mild heart attack on Saturday and was taken to the hospital immediately. He had 3 blocked coronary arteries and a stent was inserted in one to remove the blockage, though he will be requiring further treatment for the 2 other coronary blockages. But a medical board that was set up for him has decided for the moment to defer this. Well, let's go across to Saurabh for more. And Saurabh, this had been huge news at the time, when he was hospitalized. Now the good news is that the medical board has cleared that Sourav Ganguly can go home, though he has to be very closely monitored medically, that he still needs more interventions to take place. But the medical board deciding to do that later. I will just try and get Saurabh there, who's outside the Woodland Hospital where Sourav Ganguly has been being treated for the last couple of days. As we said, a medical board, in fact, had been set up to look into his health issues, and the board then had decided that to defer the angioplasty, and he will be released from hospital today. Let's go back to Saurabh for more. Saurabh, so he will be released from hospital today, though he will be very, very closely monitored, and he does need further medical interventions.
Absolutely. So the health scare that he has is not yet completely over, but yes, he will be released from hospital, and that's a relief for his fans. In fact, I mean, a lot of people have gathered here. You can see this is right outside the Woodlands Hospital in Kolkata, where Sourav Ganguly has been undergoing treatment for blockages in his arteries. At this point, the hospital feels that the immediate requirement for intervention for his ailment is sufficient. But you can see, I mean, a lot of "Love You, Dada" posters and all of that also here. Of course, fans who have gathered here to try and sort of show their support for Sourav Ganguly. He's of course more than what he is in terms of cricket. He's also practically the Prince of Kolkata, as Jeffrey Boycott described him. So a lot of fans have gathered to show their support and their happiness at his recovery, and that's something that you will witness at least outside the hospital. And there are interesting posters there of all the fans who've gathered here. Sourav Ganguly to be released from hospital at this point in a short while from now is what we're being given to understand. And that will, of course, be a relief to all his fans. Remember, there's also been a lot of speculation about his political future, so to speak, or whether he will take the political plunge or not. Obviously, those plans might be on the back burner for now, but the speculation hasn't clearly died down, even with his hospitalization for his cardiac condition. But at this point, it's a relief for his fans, happiness for his fans, as he is being released from hospital today, having undergone the necessary medical attention and intervention that was required for his ailment.
Right, Saurabh, I can see lots of fans behind you. Maybe you can speak to some of them. And yes, there was so much speculation about, the possible political role that Sourav Ganguly would be playing. And yes, for the moment now, though, the attention is on his health.
Absolutely, I'll try and get a few voices from his fans. কেন এসেছেন এখানে?
দাদাকে দেখতে, দাদাকে উইশ করতে যে তাড়াতাড়ি উনি ঠিক হয়ে যান। আমরা কলেজের অনেক দিন এখানে ওয়েট করছি। Yes. So
obviously, some of his fans
টিউশন ছেড়ে এখানে দাদার জন্য উইশ করতে এসেছি যে উনি তাড়াতাড়ি ঠিক হয়ে যান।
Some of them have bunked tuitions to come and wish him. So clearly, enthusiasm amongst fans always there. Maharaj is back, also says one poster, he's often referred to as Maharaj in Bengal. That's one of the titles that have been given to him by his fans. খুশি এখানে এসে এবারে দাদা রিলিজ করছে, দাদা প্রচন্ড
প্রচন্ড দুদিন ধরে এখানে আসছি দুদিন ধরে
আপনি এমনিতে কি করেন
আমি এমনিতে স্টুডেন্ট ফার্স্ট ইয়ার
তো কলেজ
कॉलेज থেকে दादा
अच्छा आप बताइए आप क्यों आए हैं यहाँ पे
दादा को देखने के लिए
अच्छा आप क्या करते हैं
हाँ हम कॉलेज स्टूडेंट हैं
कॉलेज नहीं गए कॉलेज बंद है
अभी तो 9 बजे आ रहा हूँ अब तो कोरोना के लिए कॉलेज बंद है खुला नहीं है
इसलिए आप यहाँ पे आए हैं Well, you know, all the fans are here. Social distancing might be a little bit of a concern, but when it comes to their favorite Dada, I think Calcuttans would love to wish him a quick recovery, and that's what you see even outside the hospital where his fans have gathered.
Right, Saurabh, thanks so much for joining us with that, and great to see so many fans gather there, some even bunking their tuitions, as they told Saurabh that they're missing their tuitions to come and see Dada. Well, with that, time for us to slip into a short break. On the other side, Divya joins us with the weather forecast, and also Divya, hailstorm in Delhi.
Absolutely, Gargi, yes, a hailstorm and lightning and thunder is what we're expecting in the course of the day, and some more tomorrow. We'll get you more details on the other side. Welcome back. Hailstorm seen in Delhi earlier this morning. More showers expected in the course of the day. It's been roaring and pouring as far as the national capital is concerned, but the minimum temperature is up. It's about 13 degrees. That's 6 degrees above the norm. What we're expecting now is that the temperature will start to slip as far as the next 3 to 4 days are concerned. From tomorrow, the temperature is going to dip back 5 to 7 degrees over the next 3 to 4 days, not just here in Delhi, but across the northwest plains. When we talk about the temperatures, they're up, they're above the norm. In fact, the temperature as far as Amritsar is concerned, that's coming in at 12 degrees Celsius. That's 9 degrees more than it should be at this point in time. Temperatures are up also in areas of Rajasthan as well as parts of Uttar Pradesh, along with parts of Himachal Pradesh, Jammu and Kashmir as well as Uttarakhand. Now, cold day conditions, that means that the daytime temperature is down by almost 4.5 to 5 degrees Celsius from what's usually expected. That is what we're expecting from the 7th to the 10th of January. Dense fog conditions are expected, and that's because moisture is being added into the air. Now, as far as the west coast is concerned, we're expecting showers along the west coast, and the sea conditions going to be rough. So, for fishermen, warning for the fishermen not to venture into the sea, as strong winds are expected along the west coast from tomorrow, and that's that we're expecting showers from all the way from Maharashtra going into Konkan and Goa as well as Karnataka, all the way into Kerala. So, basically all along the west coast, and we're also expecting showers to continue in Tamil Nadu as well as Puducherry. So from now till the weekend, it's going to start to get very cold. There's an intense spell of cold wave and cold day conditions that are expected. So bundle up, keep yourself warm because this weather is going to be dicey. With that, we're slipping to a very short break. Lots more coming up on the other side with Karpi.
Welcome back. Well, let's now take a look at the bird flu scare in several states. States such as Rajasthan, Himachal Pradesh, Madhya Pradesh, Kerala, and even Haryana are battling both COVID and a bird flu scare. A bird flu, also called Avian Influenza H5N1, is a viral disease that can spread from one bird to another and then to other animals. After tests of samples of dead birds in Rajasthan, it confirmed a bird flu. Some other states have also sounded the alert to tackle the spread. Samples of dead migratory water birds found at the Pong Dam Lake in Himachal Pradesh have tested positive for the avian influenza. National parks and wildlife sanctuaries have also been asked to take precautions, and in Haryana, 4 lakh poultry birds were died in 10 days is what is being reported. In Madhya Pradesh as well, many crows were found dead, while in Kerala, over 12,000 ducks were found dead, and now over 3,600 are going to be culled. Well, for more on this, let's go across to NDTV's Ghazali, who joins us from Chandigarh, and Sneha joins us from Thiruvananthapuram. Ghazali, first to you, this scare in Himachal Pradesh, in the Kangra Valley, where over 2,700 migratory birds were found dead, and also what's happening in Haryana. Give us the latest.
See, if we talk about Himachal, the Animal Husbandry Department, after the confirmation that these migratory birds were infected with the bird flu, now they are ensuring that it doesn't spread into the poultry farms and other such areas. So now they are on alert. The alert has been issued in the entire state. When it comes to Haryana, the Animal Husbandry Department has issued advisory after 4 lakh poultry birds found dead. Though the cause has still not been ascertained, despite the samples being sent to the Northern Regional Laboratory in Jalandhar. So the team is still collecting samples to reach to a conclusion whether these poultry deaths have been due to the bird flu or whether they were infected with bird flu or not. So alerts have been issued in Punjab, in Jammu and Kashmir, because both these states have wetlands. In the Union Territory of Jammu and Kashmir also we see arrival of migratory birds in this season, and even in Punjab in the district of Tarn Taran and Firozpur area. So alerts have been issued in Jammu and Kashmir and Punjab, and as far as Haryana is concerned, the the Animal Husbandry Department has also issued some advisory over the recent deaths. The samples are still being collected, and the lab reports are still awaited to confirm whether these deaths were due to bird flu or not. In Himachal, as I earlier mentioned, the Animal Husbandry Department is also on alert there. There has been a complete ban on the sale and consumption of poultry products in Himachal's Kangra district.
All right, and Sneha, what's the situation in Kerala? It's a big, it's a big challenge for authorities. We're already battling a pandemic now, and now this bird flu scare.
Absolutely. It's also difficult for farmers on the ground, for officials on the ground. Amid a pandemic, farmers are already handling a lot of losses. Now, Gargi, just a couple of things. One, culling process has already begun. These are localized right now in 2 districts of Kerala, Kottayam and Alappuzha. Even within these districts, the presence of H5N8 strain of avian influenza is localized. So in Alappuzha, around 20,000 birds, mostly ducks, have been culled on day 1. Around 3,000 to 5,000 birds, ducks have been culled also in parts of Kottayam. This culling is expected to continue for next 3 to 4 days in these specific areas. Now, what's important is officials are saying this has not spread beyond these areas, the affected localized areas of these 2 districts. So that does come as a relief. 2, in terms of compensation, the state government is yet to decide on that. The farmers, of course, saying that they have already been bearing a lot of losses amid a pandemic, and this has only worsened their situation. So a compensation something very closely looked at. Protocols need to be followed in terms of culling, of how this process of culling will be done. Again, complete guidelines have already been established for that. Now, there are around 26 checkposts between Tamil Nadu and Kerala, which have been set up by the Tamil Nadu government to monitor movement of, poultry or related products amid this entire confirmation of avian influenza. So that also being a very a strong check which has been put in by Tamil Nadu. No official confirmation on whether the products have been banned whatsoever. None on that yet. The Minister of Kerala saying, K. Raju, saying that there needs to be no scare and panic at this point because the spread really hasn't happened beyond these localized areas. But Kuttanad in Alappuzha, parts of Kuttanad in Alappuzha, Kottayam, in parts of Kottayam will be seeing culling over the next few days. All birds within the radius of 1 kilometer of the affected regions are expected to be culled. Now, it was in the last week of December that, you had ducks dying, the ducks which were being raised by farmers dying in large numbers, and that's when the sample was sent to the Bhopal-based laboratory, and it was confirmed for H5N8 strain of avian influenza. As of now, no human being has been infected with this strain in Kerala at present.
All right, Sneha and Ghazali, thanks so much for joining us with that. And several states now on alert and facing this bird flu scare. To talk more about this, we're joined by Dilip, Director of Animal Husbandry in Kerala, and joining us on the phone line, Dr. Mohinder Pal, Joint Director, Regional Disease Diagnosis Laboratory in Jalandhar. First to you, Dilip, if you could tell us, this is quite alarming, and as we were just discussing with our reporters, it's also something which is quite challenging for you authorities facing a pandemic, and now this bird flu scare. Do we know where it came from? Is this something that has come from migratory birds?
Migratory birds possibly. Migratory birds possibly. This outbreak may be from the migratory birds, and also climatic change is there. Now we have about 45,000 birds to be culled in the 5 focal centers. And we have done about 50% of the culling is going on, happened yesterday. Today and tomorrow we will complete the operation. And we have 25,000 birds lost. About 70,000 birds are lost from the farmers, for 8 farmers. There is no panic situation. IC activities are pregnant with the local self-government. And also Kerala, as you know, there is local self-government administration is very effective, and they are also in the field with these IC activities, and also the logistics supplied by them. The action will be completed tomorrow, and the sanitization after tomorrow. There is no panic situation.
And as our reporter was saying that in Kerala, it's remained very localized in just certain areas?
Very localized in 8 focal points.
All right.
And sorry, 5 local points. 8 we tested for it, 3 negative and 5 positive, H5NH.
All right, and it's clearly been here for a while, given that it's spread. We're getting reports all the way from Himachal Pradesh, Haryana, and down to Kerala with instances of birds falling sick and dying.
There is no spread of disease in Kerala. It is localized, and it can be controlled. It will be controlled by tomorrow or day after tomorrow.
All right, and the public has been asked not to panic over this, though farmers, of course, and poultry farmers are very upset over the setback.
No need of panic, madam. There is no problem in spreading the disease, and we have, I told that the local sub-government is actively involved in it, and they are also, with the people participation, we are overcoming this panic situation.
All right. Well, thank you for speaking to us. We also have Dr. Mohinder Pal, Joint Director, Regional Disease Diagnosis Laboratory in Jalandhar. Sir, what can you tell us about the spread of this avian influenza? And, it's being reported in several states. You have instances of crows dying in Madhya Pradesh and Rajasthan, and then, of course, the migratory birds in Himachal Pradesh.
There is only one report from Himachal Pradesh in the Pong Dam Lake.
Yes.
There we got a suspected case on 30th December, and that was considered positive, and Government of India has declared that area is not notified, and in that area we have only, that is only from, not from a domestic poultry, it is from the migratory birds, then there is no problem. We have only imposed a restriction on a 1 kilometer area by the district authority to solve the issue. We will take a sample from that area and we will re-examine whether there is a local poultry affected or not. Otherwise, there is no panic. No domestic poultry bird or backyard poultry in Himachal and in Punjab is affected so far. So what about the reports in media is that is in Haryana there is some problem where my team was gone in the evening and we have taken sample, and today morning they came back to my this lab and we will test and they'll find out whether it is from bird flu or something other.
So you're talking about the poultry birds that died in Haryana. So you're saying that we're not very sure yet whether it is indeed avian, whether it's bird flu.
We are taking a sample from that area. My team is there now, right now in the Barmala, in the Panchkula district, and we will conduct a test in the evening. Then we come to know the exact cause. Surely we cannot say that it is from the bird flu. In our state, in the Punjab state, there is not a single case of bird flu till that day, and there is no need to be panic. No need to panic. No need to panic.
Right, sir, and so we're saying that this could have come from migratory birds. Also, a worry for the poultry farmers, of course. Yes.
Oh, no problem. No problem. It's only in the migratory birds, and this is not found in the local birds.
All right, we're also joined by A. Alexander, the collector of Alapura. Thank you so much for being with us. Tell us about the situation in your district.
Yeah, it is okay. We have completed the culling of 20,000 ducks yesterday. Remaining 14,000 we will do the process today. So the entire process will be over today evening. In 4 panchayats, we already the health team and also the animal husbandry team and the local panchayat and every department is active in the whole area of the panchayat. We have taken all preventive measures in that area of panchayat, and also we are giving preventive medicines also the laborers and farmers and all that. And also we are as a part of surveillance we are doing the checking these temperature and fever and things also. That kind of things also going on. The sanitation also going on in and around the area where the culling takes place. The sanitation also going on.
All right, sir, and you're asking people not to panic, that you've managed to, get control of the situation currently, and as you said, more birds will be culled, and it's very localized there in Kerala.
There is no need of any panic because that is the local area where the things identified, identified is under surveillance. So there is no need of any panic. So we need, precautions. So that we are well taken place of that.
All right, Dr. Pal, still with us there, sir. What about these worries about avian flu jumping to humans, and there've been no reports on that till now? Well, we seem to have lost the line there with Dr. Paul, but that is the situation. As we said, an alert in several states over the bird flu scare, and as we were reporting from Kerala and in Himachal Pradesh as well, where migratory birds were found dead. An investigation in Haryana after poultry birds were also found dead, but authorities have been saying not to panic, but to remain on alert. So several states are on alert given these reports of bird flu being found in some of the states, and deaths of crows being reported, as we said, in Madhya Pradesh, in Rajasthan and in Gujarat as well, where dead birds were found. Well, let's shift focus now and get you more excerpts from former President Pranab Mukherjee's memoirs, Presidential Years, where he recounts his career, and some more excerpts have emerged. Now, he writes in his book that Modi 1.0 failed to ensure the smooth functioning of Parliament, that the Prime Minister must listen to dissenting voices and speak more often in Parliament. Also about his Lahore stopover, Pranab Mukherjee wrote that it was unnecessary and uncalled for. He also more excerpts about what he said about the Congress, that the Congress lost focus after I became president, and that Sonia Gandhi was unable to handle affairs of the party. Well, let's go across to Sanket for more on this. And Sanket, tell us more about what is written in these memoirs, and also when is the book going to be out?
Yes, so the book is out now. It's called The Presidential Years by Pranab Mukherjee, recounting the period from 2012 to 2017. And initially we had seen some excerpts, and now, of course, more details are there right there in this book. Now, he has mentioned a thing or two about the Prime Minister directly, where he says that Modi won. That is the period between 2014 and 2019. Narendra Modi failed to ensure the smooth functioning of Parliament. So that's a direct critique of the Prime Minister. He says Modi must listen to dissenting voices and must speak more often inside Parliament. So that's an important suggestion for Narendra Modi. On that very famous 2015 Lahore stopover, the President felt that this was unnecessary and uncalled for. Let's juxtapose this to what Pranab feels about Modi and his equation with world leaders, which is also equally important, where he says, and I quote, I oppose expressions like personal friendship. Now, that is something we have seen being used a lot. He says friendships are between countries, not individuals. Special friendships have no worth in international relations. And then the critique of Modi again. Prime Minister Modi plays up personal equations too much. To take such relations as true is absurd. Now, these are strong observations by the former president on the equations with world leaders. On Congress, he says that the Congress did lose focus when he became president, that Sonia Gandhi was unable to handle the affairs of the party, and Dr. Manmohan Singh's prolonged absence from parliament put an end to personal contact with the MPs, which eventually led to the loss of the Congress party in 2014. Now, these are excerpts that were already out about the Congress. Very interestingly, there is a chapter, a paragraph rather, in this book on what if Pranab Mukherjee was not president and continued to be in active politics. To that, in that paragraph, he says that I would have made sure that Mamata Banerjee does not leave the UPA. I would have made sure that Telangana would have never been formed. So a lot of I would have made sure had I been in politics is also there in this particular book. So this is a very interesting, very many interesting facets to his personality from his presidential years. Just leaving you with one more excerpt from this book where he talks about former US President Barack Obama and how there was almost a sort of a minor diplomatic glitch or a standoff when the former president for the 26th January parade insisted that Pranab Mukherjee come in his car for security concerns, to which Pranab Mukherjee politely disagreed and turned this proposal down, and how this whole situation was managed. So a lot of interesting excerpts from his presidential years right here in this book.
All right. Thanks so much, Sanket, for joining us. So that book is out, and Sanket, they're bringing us some of the highlights from the book. With that, time for us to slip into a short break. On the other side, we'll get you all the international news. Stay with us.